My name is Stephanie Blank, and I'm the Director of Gynecologic Oncology for the Mount Sinai Health System and the Director of Women's Health for the Blavatnik Family Chelsea Medical Center at Mount Sinai.
Great. And what is cervical cancer?
So cervical cancer is caused by abnormal changes in cells that are on the cervix. And the cervix, as many of you know, is the bottom part of the uterus, the part that actually expands when somebody has a baby. So when abnormal cells, when the normal cells become abnormal and then get further abnormal, they sort of don't obey the normal rules of cell growth and they grow out of control. And that's what cancer is in a very simplistic way.
And what are the symptoms?
The symptoms of cervical cancer, sometimes there's no symptoms at all and it's picked up via pap smear. And I think we'll talk about that a little bit later. But when you think about some of the kind of hallmark symptoms of cervical cancer, you think about really abnormal vaginal bleeding. And what is abnormal? Abnormal is usually a thing that will go with cervical cancer is bleeding between periods or just heavier than usual. Bleeding after sex is a pretty typical symptom, and just any kind of abnormal bleeding. Additionally, having an abnormal vaginal discharge or an odor could be some of the symptoms.
And who is at risk for cervical cancer?
So cervical cancer affects anyone with the cervix, so people that are born as females. It usually affects people between the ages of about 30 and 55, but it can happen again on either side of that. And it's a little bit more common in people that haven't been screened in a long time. There is increased risk with smoking or in people that are immunocompromised. And almost all cervical cancer is caused by a persistent infection with the human papillomavirus or HPV. So having HPV puts somebody at increased risk. As I said before, smoking weakens the immune system, and a weakened immune system can lead to that HPV infection sticking around and becoming persistent. And that's when it has the possibility of turning to cancer.
And how common is it?
Well, so in the United States, there's under, just under 15,000 cases about per year, and about just under 4,500 women are going to die of cervical cancer in the US. Worldwide, cervical cancer is a bigger problem. It's actually the fourth most common cancer diagnosed among women. More than 500,000 women worldwide were diagnosed with cervical cancer in the past year. And about half of that number, about over 300,000 women died from the disease in a year worldwide.
Can cervical cancer be prevented?
The good news is that cervical cancer can be prevented. And we have a vaccine, the HPV vaccine, that offers really good prevention against cervical cancer. And again, as I mentioned before, almost all cases of cervical cancer are associated with HPV. So if people get the HPV infection, they actually have the possibility of preventing this really difficult disease.
And who should receive the HPV vaccine?
So ideally, we want to vaccinate young children before they become sexually active, and this can prevent both cervical precancers and cancers. Specifically, we want to vaccinate both boys and girls, ideally at age 11 to 12-year-old, and certainly before they become sexually active. And that will give us the greatest benefit of the vaccine. All young people aged 9 to 26 are recommended to get the HPV vaccine. And actually, it's available for people now, both men and women, up to the age of 45. So all these people can get the HPV vaccine. There is a little bit, there is some evidence too that even if you haven't had the vaccine and then you have abnormal cells, getting the HPV vaccine, even outside of those age ranges, may be helpful in terms of allowing your body to clear the virus.
Besides the HPV vaccine, are there other ways to lower the risk?
An important way to lower the risk of cervical cancer that people don't usually think about is to stop smoking. Smoking actually, causes HPV to stick around when it might otherwise be cleared, causes, a regular infection to be more aggressive. And when somebody has cervical cancer, it causes them to do worse. So when I see somebody who has HPV or anything like that, I give them a really significant talking to about stopping smoking. Another way to limit risk is to limit exposure to HPV. This is really hard because more than half, almost all the population has HPV at some point in time. Condoms may have some role in this, but again, that's not 100% by any means. Limit your exposure to the number of sex partners. You will likely limit your exposure to HPV, although you never know. You could have HPV after one sex partner as well. Another way to lower your risk is to get regular cervical cancer screening and follow up with the results.
And how long does it take for cervical cancer to develop?
So cervical cancer actually takes quite a while to develop, probably around 10 to 15 to 20 years, even in people with regular immune systems. In those with compromised immune systems, it'll take more like 5 to 10 years. One of the reasons why we're able to screen for it is because it takes a while to develop. So there's a lot of knowledge about sort of the precursors to cancer or the precursors. So when we see those, we intervene, and that's how we really prevent cervical cancer.
And how is it diagnosed?
So there's different ways that cervical cancer is diagnosed. If somebody, in the patients that don't have symptoms, it's usually diagnosed after somebody has an abnormal pap smear, and then they go to their doctor, and the doctor takes a closer look at the cervix using something called a colposcope, and then performs biopsies. And via those biopsies, cervical cancer is diagnosed. If somebody has abnormal bleeding and they get an exam because of that, then usually a biopsy would be performed. At that point, it's not a pap smear situation, but the way it's diagnosed is really in the pathology lab by a tissue biopsy.
What are the treatment options?
The treatment options for cervical cancer depend on how far it's spread. So if cervical cancer is quite early on, it can be treated with surgery, and it can be treated with surgery that intends to cure it. In certain situations, again, I mentioned that a lot of these patients that develop cervical cancer are quite young. Fertility sparing surgery is possible, and we've actually done a lot of work looking at ways. We looked at a lot of ways to kind of limit how aggressive surgery is to allow for fertility after the fact. In patients for whom we're not preserving fertility, we can perform surgery to remove the cervix or remove part of the cervix or remove the cervix, the uterus, and part of the tissue around it to treat cervical cancer. We also do a lot of investigation of the lymph nodes in that area. Now, in a lot of cases where cervical cancer is either too large or has spread beyond the cervix, it's no longer a surgical disease, but we then generally use both radiation and chemotherapy together to treat it, and this has really excellent results. We've actually had a lot of advances in the past couple of years in the treatment of cervical cancer, and just to be pretty brief about it, one is using targeted agents. We have some that basically stop the tumor from growing blood cells, and when that's used with chemotherapy, people do very well, have better responses. Cervical cancer does really well with immunotherapy. Certain cervical cancers, of course, not all, but that's been a big advance. And most recently, using immunotherapy with chemotherapy has been shown to be very effective. And then lastly, we have a newer class of drugs called antibody drug conjugates. It's another way basically of targeting the tumor, but these all work differently. And it's just having more options for patients is definitely a big advance in the management of people with cervical cancer.
What is the chance of recurrence after treatment?
The chance of recurrence after treatment really depends on how advanced the cancer was to start. It can be low, under 10%. It can be over 60%. So at the beginning of treatment, part of it will depend on how much needs to be done and if the treatment is likely curative, which it is a lot of the times. If it's very advanced, it's much less likely to be curative.
And lastly, what should I do if I think I have cervical cancer?
So a really important thing to know is if you think you have cervical cancer, you should be seen by a gynecologic oncologist. That's a doctor who is specifically trained in specialized training for caring for women with gynecologic cancers. And cervical cancer is a cancer where it really makes a difference. So that is really imperative. Gynecologic oncologist if you have cervical cancer.